joining on the program Dr. N.K. Mehra, former Dean of AIIMS and Honorary Emeritus Scientist, ICMR. Also with us, Dr. Ishwar Gilada, Secretary General of Organized Medicine Academic Guild, OMAG. Very good evening, gentlemen. Pleasure to have you with us here on Mirror Now. Dr. Mehra, the larger perception or the larger picture that is coming in is that hospitalizations are low, but there is a concerning uptick. What is the level of concern at this point of time?
Well, there is a definite surge in terms of numbers. The numbers are rising due to one of the variants that we call XBB.1.16. Whereas in the US, it is XBB.1.15. XBB 1.6 is now spreading all over the world. It is probably now seen about more than 30 countries now. But there's no point at this point of time of panic. What we are saying is that people with low immunity or people over 65 years of age, if they have to visit crowded areas, they might wear a mask. Or not might, they should wear a mask. The numbers are going up, but the recovery rate is also very high. Right. At this point of time, the recovery rate is something like 98.5. So the numbers are increasing. We don't want to send a panic amongst the masses right now.
Yes.
The only thing is that people with immunocompromised host, people with cancer, diabetes, and those who have undergone an organ transplant or a bone marrow transplant, whose immunity levels are low, if they have to go to any crowded areas, they must wear a mask.
Yes, so you've rightly pointed out the vulnerable groups, and that is an information that we of course, want to put out here for the benefit of our viewers. Dr. Gilada, I want to also ask you a little bit of details on the nature of the virus this time around. There's a lot of curiosity around it. We were hoping it would be a much defeated virus now because of the immunizations that have happened across the country, but it seems to be back. What, according to you, is kind of, the nature of the present COVID-19 strain?
See, this is one of the ripple effects of what you can see a major wave. There is not going to be a major wave at all. Secondly, for last 15 or 16 months, we have not seen a new variant. All these are subvariants of Omicron. And Omicron, particularly BA.2, and India already has BA.2 for a long, long time. India did not allow BA.4 and 5, which made a lot of surges everywhere. Now, this XBB or XBB.1 or 1.16 or XBB.2.34 and 35, all these are the recombinants of Omicron. And the recombinants are not going to play a major havoc. The major problem has been that those who have been naturally infected, it has been sometime 1.5 years, 2 years back. Those who have been vaccinated, again, it has been 1.5 years, 2 years back. There has been very low uptake of a third dose. Nationally, 30%, in a state like Maharashtra, only 15%. So those who have taken the second dose, it is already 1.5 years back. So there has been a waning immunity of either naturally acquired or vaccine acquired. And that's the reason we are getting infected. But these infections are not causing oxygen demand, bed demand, ICU demand, ventilator demand, and deaths. And therefore, we need not be worried. What is worrying, as Dr. Mehra said, is that those which are with comorbidity or those which are above 60. So those people need to be protected. And anyways, if and when they die of any of the disease, the COVID is one of the causes, but it is not the main cause. They die of something else, and that is mainly driven by the comorbidity they are suffering from. So we need to protect them. And those people who are working outside, or school children going back and forth to their grandparents, they should protect their grandparents. And one of the ways is that grandparents themselves use masks, because they cannot expect everybody in the family using masks. So if and when any relatives come to meet them, if and when the family members who are working outside coming back and forth, then these comorbid people should use masks. Otherwise, mask mandate is not required. Mask request is required. Mask requesting in particularly when you are commuting in crowded places, going to theater, going in programs, going in markets. At that time, you should use mask. Otherwise, mask mandate is not required.
Okay, you're saying that indiscriminate masking is not required only when there is a situation of a large gathering in a confined space. And we know the drill by now, Dr. Mehra. In fact, people are aware what they're supposed to do. It's just about following that COVID discipline. But the other FAQ that keeps coming up, Dr. Mehra, is that influenza virus and COVID-19 are very similar in terms of symptoms. It's causing a lot of confusion. With each new case, a person or a family or an entire community gets affected. What can we tell our viewers regarding how to distinguish the two?
Yeah, there's so much of overlap in these two infections over there. And what the basic rule is, if you have a running nose, fever is, of course, common on both sides. Running nose is more likely to be the flu virus. If it's a stuffy nose, it's more likely to be COVID. And of course, we have seen a lot of people also, those who have got the COVID now, and the aged group, there even the oxygen saturation levels are going down. So I think if you do have the COVID, then we should also measure your oxygen levels as well. What we have seen is in the last 1 or 2 days, the total number of infections in India have gone to more than 10,000. And last year, and this 10,000 number we have seen after a gap of about 223 days, because the last time, as I remember, more than 10,000 was only on August 31 last year. So, and of course, Maharashtra and Delhi have seen more than 1,000 infections. So the labs are also saying that there is a positivity rate is going up. But as Dr. Gilada also said, there's nothing to worry. The infection is not very, it's not going to give you a very severe kind of infection. But people who have not taken the third dose, our request to them is that they must rush and take the third dose, because at this point of time, the rate at which we calculate the number of people who have taken the third dose is really very low.
So I think that's a big takeaway then from this conversation. Dr. Gilada, quick last word to you, since you pointed out that our concern here is waning immunity. A lot of people are not taking the third booster dose. You recommend that for a larger safety, for greater protection at this point. Anything else that you would like to tell viewers who are watching us right now on how to protect themselves?
Afrida, even if we mandate and tell people to take third dose, where are the doses available? So there has been a little bit lack of planning. And we made almost more than 10 to 11 crore doses to expire. And now when we need the dose, they are not available. So people, when it was available, not taking, there is no forward planning properly. There is no order placed with the companies which are manufacturing the vaccine. So under this situation, whatever vaccines are available, which are heterologous currently, which are Corbavax, Covax, or nasal vaccine, they should be utilized immediately. They are already on the portal. So, and secondly, vaccine should be made available with all the doctors. Why ration the vaccine? If I can use typhoid vaccine, I can give my patient the pneumovax vaccine, influenza vaccine. Why can't I give COVID vaccine? So I think the government of India should open the vaccination of COVID with all the doctors, so that doctors will place orders and companies can manufacture and can that vaccine can be utilized. So unless until that is done, just mandating and asking people to take vaccine when vaccine is not available is a futile advice.
Right. This is important. So the onus is both on the government and on the citizens. For the citizens, of course, the COVID discipline. The government, again, like you mentioned, need to gear up once again with the facility, especially with the availability of vaccines. Thank you so much, Dr. N.K. Mehra, Dr. Ishwar Gilada, for joining us this evening.
Very much. Thank you.
Let's take a short